Minister of Health and Wellness, Dr. Christopher Tufton, gave an update on the recent quarantine measures in the Church Corner community in St. Thomas and Sandby, Clarendon. Melvin Pennant has that story.
This is what has represented a big part of the success of Jamaica's approach to COVID. And it is inconvenient to those who are affected, but frankly speaking, it's the most effective way. So we crave the patience and indulgence of those who are affected, and we say thanks to those who are involved in the process.
Dr. Tufton says Parish Health Department and its partners continue the work on the ground, providing medical surveillance, welfare, public education, and pharmaceutical services.
Summary of our efforts on Wednesday, August 12th, as it relates to the quarantine areas are as follows. Health team members on the ground in Clarendon, in Sandy Bay and its environs, 45, in St. Thomas, 51. Home visited, 445, St. Thomas, 3, that's 445 for Clarendon, 339 for St. Thomas. Persons interviewed, 1,026 in Clarendon, 354 in St. Thomas. Persons reached by the health education officer, 626 in Clarendon, 200 in St. Thomas. Samples collected, 285 in Clarendon, 371 in St. Thomas. Positive cases, 2 additional, and 20 in the case of St. Thomas. 2 additional in Clarendon, 20 in St. Thomas. And prescriptions filled by the NHF, 54 in Clarendon and 189 in St. Thomas. It's interesting to look at these numbers because it tells a deeper story around the status of those communities in terms of what is available, the health profile and so on.
He urged Jamaicans to take responsibility for their health and observe all the safety protocols like wearing masks and sanitizing, especially for those who are under house quarantine.
COVID's still a keep. It's not completed. And so everyone has a role to play. Everyone counts. And it is very important, particularly now with over 26,000 Jamaicans being quarantined at home, having come into the country for the most part, that we observe the protocols, because otherwise we're going to see community outbreaks that we really don't want, or transmission.
Melvin Pennant, PBCJ News.